Hello, my name is Carson Liu, and I'm a general surgeon and weight loss specialist in Southern California. My career has been dedicated to understand the unique issues that confront patients struggling with overweight and obesity, and I've had great success with my approach to short and long-term weight management. There's a need for both prevention and treatment. I perform hundreds of bariatric surgeries a year and work with my patients pre and post-surgery to achieve optimal results. It's been established that for many patients, diet and exercise alone are not enough to reach their weight loss goal, and for morbidly obese patients, exercise can be difficult to initiate. I work with my patients on a long-term weight management plan that includes diet, exercise, weight loss medications, and surgery. I include maintenance and preventative care as part of the comprehensive plan. In my practice, I use prescription medications that are FDA approved for short and long-term use. And for patients who don't have heart disease or other contraindications, I prescribe Lomera, the 8 mg dose of phentermine, because patients can take a dose before lunch and dinner. This has helped some patients who have breakthrough hunger in the afternoon and evenings. These patients report that they're not thinking about food all day long, and being able to suppress their appetite at dinner has really helped. And I like being able to prescribe the lower dose of phentermine throughout the day versus a high dose in the morning. There's less drug in the body.
Lomera is an FDA-approved prescription medication used for a short period of time for weight reduction in adults with an initial body mass index of 30 or more, or 27 or more with at least one weight-related medical condition, such as controlled high blood pressure, diabetes, or high cholesterol, and should be used together with regular exercise and a reduced calorie diet. Body mass index, or BMI, measures the amount of fat in the body based on height and weight. Don't take Lomera if you have a history of coronary artery disease, stroke, arrhythmias, congestive heart failure, or uncontrolled high blood pressure, are taking or have taken a monoamine oxidase inhibitor drug within the past 14 days, have overactive thyroid, glaucoma, agitation, or a history of drug abuse, are pregnant, nursing, or allergic to sympathomimetic amines such as phentermine or any of the ingredients in Lomera.
For my post-surgery patients who reach a plateau or experience weight regain, I prescribe Lomera before a meal when they feel they may be slipping. I use Lomera for my patients who've had a gastric bypass, a sleeve gastrectomy, or even a gastric balloon who are struggling to reach their goal weight, and the Lomera has really helped them achieve their goals. Patients love it because there's very little side effect as compared to the higher dose phentermine where they take in the morning and they feel fine, but then at night they're struggling. I also like Lomera mainly because it is the lowest drug cost of all my appetite suppressants that I offer. So we offer about 4 different FDA approved drugs in my clinic, and a lot of people love the drugs, but some of them are so expensive they can't afford it. So the drug cost is a huge factor for my patients, and almost all my patients have severe hunger when we pull out the balloons. So we put them on Lomera for 5 to 10 days, and they love it. It really helps to keep their hunger down so that they can maintain that weight loss they achieved with the gastric balloon. As a weight loss doctor and a weight loss surgeon, I feel that Lomera is an important instrument in my toolbox to really help them to lose weight. I look forward to having people come in, and whether I give them an endoscopic balloon or a surgical procedure, I love the fact that I have Lomera to achieve their weight loss and to keep the weight loss going. And I like Lomera mainly because of the cost, the fact that there's minimal side effects, and mainly because it works.
Don't take Lomera if you have a history of coronary artery disease, stroke, arrhythmias, congestive heart failure, or uncontrolled high blood pressure, are taking or have taken a monoamine oxidase inhibitor drug within the past 14 days, have overactive thyroid, glaucoma, agitation, or a history of drug abuse, are pregnant, nursing, or allergic to sympathomimetic amines such as phentermine or any of the ingredients in Lomera. Taking phentermine with other drugs for weight loss is not recommended. Primary pulmonary hypertension, a rare fatal lung disease, has been reported in patients who had taken a combination of phentermine and fenfluramine or dexfenfluramine for weight loss. The possible association between phentermine use alone and primary pulmonary hypertension cannot be ruled out. Patients should tell their doctor immediately if they experience any decrease in the amount of exercise that they can normally tolerate, shortness of breath, chest or heart pain, fainting, or swelling in the lower legs. Serious heart valve problems or disease have been reported in patients taking a combination of phentermine and fenfluramine or dexfenfluramine for weight loss. The possible role of phentermine has not been established, therefore the possibility of an association between heart valve disease and the use of phentermine alone cannot be ruled out. If your body becomes adjusted to the maximum dose of phentermine so that its effects are experienced less strongly, the maximum dose should not be exceeded in an attempt to increase the effect. Caution is advised when engaging in potentially hazardous activities such as driving or operating machinery while taking phentermine. Phentermine has the potential to be abused. Keep Lomera in a safe place to prevent theft, accidental overdose, misuse, or abuse. Using alcohol with phentermine may result in an adverse drug reaction. Phentermine can cause an increase in blood pressure. Tell your doctor if you have high blood pressure, even if it's mild. If you are taking medicines for type 2 diabetes, your doctor may have to adjust these medicines while taking phentermine. Some side effects of phentermine that have been reported include pulmonary hypertension, valvular heart disease, palpitations, increased heart rate or blood pressure, insomnia, restlessness, dry mouth, diarrhea, constipation, and changes in sexual drive. These are not all of the potential side effects of phentermine. For more information about Lomera, ask your doctor or pharmacist. To report negative side effects of prescription drugs, contact FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For full prescribing information for Lomera, please visit www.lomera.com.